So it's our pleasure to introduce Lauren Ravon, Executive Director of Oxfam Canada, to deliver a keynote titled Care is at the Heart of an Economy That Works for Women. Lauren Ravon has been with Oxfam Canada since 2011, holding a number of roles, including Director of Policy and Campaigns, and working tirelessly to put women's rights at the heart of the global Oxfam Confederation. Before joining Oxfam, Lauren worked at the International Center for Human Rights and Democratic Development, where she was program manager for the Americas and oversaw the center's office and human rights programming in Haiti. She has also worked on programs to tackle gender-based violence and promote sexual and reproductive rights with Planned Parenthood Global and the International Rescue Committee. Lauren has conducted extensive policy research and campaigned on issues of food justice, women's economic equality, sexual and reproductive health and rights, and the role of women's movements. She holds master's degrees in international affairs and development studies from Columbia University and the Paris Institute of Political Studies. Lauren, welcome.
Thanks for the introduction. I'm really glad that I got to catch the tail end of the last conversation. I haven't been here since the start, but that was phenomenal. So thank you so much for the work that you're doing. It was great to hear directly from you on that. So I guess I'm going to be switching gears and talking about the topic of care today. And I'm really happy to have the opportunity to be here with you all. Thanks to Mothers Matter Center. Thanks for the invitation. I would say that the work that you do really embodies the spirit of collective action for social change. And that resonates very deeply with me personally and with the work that we do here at Oxfam Canada. So I wanted to start just by saying a few words about the organization that I run to put what I'll be talking about in some context. Oxfam Canada is part of a global network that works in over 60 countries to end the injustice of poverty, with a focus specifically on improving the lives and promoting the rights of women and girls. Now, what makes Oxfam unique is that we connect three very different spheres of work that many organizations will do separately. So we work with local partner organizations to run long-term development programs that provide people with knowledge, tools, power to address the poverty and discrimination they're experiencing, and ultimately to radically challenge the structures of inequality that hold them back. On top of that, we also respond to humanitarian emergencies when disasters strike. So that can be in the case of a civil war, a natural disaster, a response in a refugee camp. And there we'll work with local communities to provide emergency relief, in particular access to water and sanitation. And finally, we do research, policy, and advocacy work to challenge sexist, classist, and racist social norms and systems that keep people trapped in poverty. So when there's opportunities to work with governments to drive change, we do that. And when governments and powerful corporations stand in the way of change, we call them out. Over the last 15 years, Oxfam Canada has taken a deliberate focus on putting women's rights at the heart of everything we do. We're a proudly feminist organization guided by feminist principles, and we believe that supporting women, their movements, their organizations, all of that is the most effective and powerful way to drive change. And I know this has been the thread of the conversation from the start, but we know that when women's rights are respected, women are healthier, better educated, better paid. They can live free from violence. And this also has a ripple effect on their children and their communities and creates lasting benefits for generations to come. So for the past decade, Oxfam has increasingly focused on issues related to care work. And so that's what I want to focus on today. Now, I assume that most of you will already know why care work is so important to our society and our economy. I'm sure that every single one of us in this virtual room has been cared for, has also cared for someone else at some point in our lives. Care, I would say, is really kind of the glue that holds our society together. But we also know that care is at the heart of many of the most deeply seated social, economic, and gender inequalities. And this is what we're actively looking to dismantle. On the flip side of that, we believe that recognizing, valuing, and investing in care can be one of the most powerful pathways to building a more just and actually a more green future for us all. So I want to give a few examples of the important role that care plays and some of the challenges that we're witnessing in this work around the world. So caring for other people can certainly be one of the most rewarding activities in our lives. And I say this as the mom of a 3- and 5-year-old boys. So it can certainly be incredibly rewarding, but the unequal distribution of unpaid care work is also one of the biggest barriers to women's economic justice. So now, no matter where you live in the world, women hold the disproportionate responsibility for unpaid care work. Here in Canada, women spend on average 1.5 more hours on care every day than men. But in other countries, women can spend as much as 10 times more hours on care than men. This is due to unequal gender norms, just like here in Canada, but in other countries, it's also due to lack of infrastructure and public services, which means that women have to dedicate many hours each day simply to access water for their family to drink and bathe, spending hours collecting firewood to prepare meals, even more hours looking after babies or young children when there's no affordable childcare or daycare services in their community. So according to the International Labour Organization, every day, 16.4 billion hours are spent on care. 16.4 billion hours. So to put this in perspective, this would be the equivalent of 2 billion people working 8 hours a day, 7 days a week, all year with no pay. If this work was actually recorded and recognized, it would amount to about 9% of our global GDP. And yet we all know that this invisible work never appears on the books. Now, when it comes time to paid care work, the majority of that is also done by women, and especially racialized women. So think, for example, of nurses, of women who provide elder care, childcare workers. So this is the paid dimension of care work in our society. So it is paid, but sadly, this paid care work is rewarded with poverty wages and poor working conditions in most circumstances. In many countries, and many countries where Oxfam works, the bulk of paid care work is actually carried out by migrant workers. So women who have precarious immigration status, lack labor rights protections, and are at the greatest risk of exploitation and abuse. And of all the people who work in the paid care economy, it's domestic workers who are often the most exploited and have the most precarious employment conditions. But even in somewhat better paid sectors like health or education, workers face really difficult working conditions and are at a high risk of burnout. In a country like Canada, where our collective care is actually increasing, our need for care is increasing with the aging of our population, the care sector finds itself in this constant retention and recruitment crisis because the conditions of work are so bad. And so while the dynamics around the care economy are complex, there is really one very simple reason why this work is so undervalued, and that's patriarchy. It's really as simple as that. In our society, the act of caring for other people is perceived as a natural extension of women's existence that requires no skills. Just think of this. In North America, people are often willing to pay more to have someone mow their lawn or remove snow from their property than they are to pay someone to care for their toddlers or their babies. So that tells you what we value and what we don't. I just want to let that sink in. At Oxfam, our work on care is guided by something called the 5 R's framework. And so I want to break this down because it really guides the work that we do advocating on the care economy. So 5 R's. The first R is recognize. It means that we need to start by recognizing how important and essential care work is for our well-being, our society, and our economy. For this reason, a big focus of Oxfam's work on care is precisely to work with communities to shift attitudes and social norms so that we better collectively value the importance of care. The second R is reduce. So simply reducing the time spent on unpaid care work. So as I said, some care work, some unpaid care work can be gratifying and beautiful. A lot of it is pure drudgery and a huge time sink. This is particularly the case for women living in poverty who lose so many hours on household chores that could be reduced if the state provided access to essentials like clean water, electricity, and quality social services like childcare and elder care. The third R in the 5R framework is redistribute. So redistribution needs to happen at two levels. We need to redistribute between women and men, but we also need to redistribute between families or households and the state. Now, the fourth R of the framework is reward. This one is very easy. It means that care workers should be paid fairly. And finally, the fifth R is represent. Care workers need to have the freedom to organize and demand better working conditions, including through unionization and collective bargaining. For example, this is something that one of our partners, the International Domestic Workers Federation, has been fighting for in many countries around the world, the right to be represented as care workers. Now, I want to give you a few examples of how we applied this 5R framework in the multiple facets of the work that Oxfam's done. I'll start with our work responding to humanitarian emergencies. So every single time a disaster strikes, no matter where you live in the world, women's care responsibilities go through the roof. This is often because essential infrastructure is damaged or destroyed, kids are out of school, your loved ones might have been injured or traumatized. For example, in the last few weeks, I've been hearing from my female Oxfam colleagues who are stuck in Gaza, who've been telling us that they are doing everything they can to ensure the well-being of their children, whether this means waiting for hours and hours and hours to fill jerry cans with clean water, but also sometimes just spending extra time with their kids reading stories or being with them to give them some respite from the horrors that are around them. A lot of this work falls on women. So in Oxfam's humanitarian assistance programs, we deliberately recognize the care work that women are doing as life-saving work. And we include them in our cash distribution schemes because we know that women are really often left out of traditional humanitarian cash for work programs, precisely because they are providing unpaid care for their families. We also work with communities on longer-term development projects to shift social norms related to unpaid care and support care workers in their struggle for decent working conditions. One really great example that I have been able to be involved in is a project in Bangladesh. So in Bangladesh, rural women who migrate to the capital, Dhaka, often have no other employment opportunities than to become domestic workers. The domestic workers represent 17% of Bangladesh's total labor force, and yet they're not allowed to have the minimum wage. They often have to work around the clock, and they have been systematically excluded from legislated labor protections. So that's why our work with partners in Bangladesh focused on supporting domestic workers, because they are often socially very isolated, to come together, organize, and form collectives to advocate for their rights and also call out cases of abuse, which are many. And finally, on the advocacy front, Oxfam has been at the forefront of advocating for investments in the care economy for many decades. Here in Canada, we worked alongside the childcare movement to push for the very, very long-awaited $30 billion commitment to building a national childcare system here in Canada. And now that that has been announced, we're focused on ensuring that new childcare spots that are created in this country are actually accessible and culturally appropriate for historically marginalized children and their families. Another example that's quite fun is in the Philippines, where Oxfam launched a huge social media campaign trying to change attitudes around men and boys and their role in the care field. Now, I wanted to come back to the title of this event today, Community-Led Solutions. This really resonates because while we know that care is a universal necessity and that universally it requires more recognition and investments, what that actually look like is very context specific. So in some places, like in rural Malawi that I recently visited, that starts with basic things like electricity and water to reduce the time spent on domestic chores. But in the global north, and in particular here in Canada, We're fighting for care to be recognized as a public good and want to see more investments in care-focused public services. So that's why it's really important to have contextually specific approaches to investing in care. In every context, though, regardless of the country, regardless of the community, we know that investing in care is one of the most effective ways to fight inequality and build an economy that works for women and families. So I'm just thinking of everyone in this virtual room. How many women in your lives have had to choose between working or caring for their kids or an elder parent? How many women do you know who went on maternity leave and then were passed up on a promotion or couldn't get that next job? You know, these are stories that we have all heard of. And so having a strong care system means freeing up women's time so that they can pursue good jobs, earn a decent income, support their family, and also save up for retirement. Unequal care responsibilities is the biggest contributor to the gap between male and female labor force participation and the gender pay gap. So women have to work on average 14 years longer than men to earn the same in their lifetime. And it's no coincidence that single senior women are some of the poorest members of our society. Now, on the flip side of that, the care sector, so whether it's health, education, childcare, elder care, is such a vital sector of our economy, and it's actually one that's growing. So this sector of the economy provides millions of jobs, and yet it's chronically underfunded and it's plagued by poor working conditions. So you can see that we have got something fundamentally wrong in what we value. Now, investing in the care economy can have a triple benefit that's very simple. It's a great source of employment. It ensures that people actually get the care they need so that they can thrive. And it advances gender equality and women's rights. On top of that, it's a low carbon sector that can grow our economy in a sustainable way, which is what the planet needs right now. Now, with climate change creating more and more climate disasters, we're going to see a steep increase in the need for care and care services. We're already seeing that today. We know that more and more people will be impacted by the climate catastrophe, whether that's here in Canada and in every single country around the world. We know that many women in the global south already can't feed their kids and have to work further and further to find food and water. Many people are going to be sick due to spreading and new diseases or are going to be injured during disasters. And many more people are going to be displaced from their communities and lose their livelihoods because of climate change. This is a certainty. All of this is going to translate into more unpaid care work for women, but also an increasing demand for paid care services. Now, the COVID-19 pandemic clearly showed us that we are not ready for this and that our care sector will not be able to handle a spike in demand. Even before the pandemic, the International Labour Organization estimated that 2.3 billion people would be in need of care by 2030, 2.3 billion people. This means that we will need millions more care workers as well. So how I think of this is that everything I've spoken about just now is kind of two sides of the same coin. On one side, the unequal distribution and unfair recognition of care makes our society more unequal, less healthy, less happy, and less prosperous. And then on the other side, recognizing and investing in care actually empowers women, helps close the gender gap, and builds our collective well-being, resilience, and happiness. So I would just say the answer is very simple. We need to work on flipping that care coin. So I will leave it at that for now, but happy to have a conversation with this virtual room on our care work.
Thanks so much.
Back over to you, Amy. Yeah.
Thank you so much. Absolutely, we do need to value care work, especially when we actually are experiencing a shortage of care workers, like not just like not talking about mothers, but like doctors, nurses in Canada, in North America generally, but mothers too are like often very undervalued for their time. So I'm wondering if there's any questions. Hillary says many women are shifting to entrepreneurial roles so that they can have more flexibility for care responsibilities. How can we better support women as small business owners?
Yeah, I think a lot of us can identify with that question in terms of needing flexibility to juggle everything. I think the answer there is coming back to the idea of redistributing care responsibilities between the family and the state. So we need to have more public services that provide care respite to families and to women in particular. So things like having affordable and quality childcare that is close to where you live, even if it means that you live in a rural or remote community. It also means having easily accessible medical care, better and respectful and quality elder care services. So again, the idea is that we can't solve the kind of the high care burden at the family level alone. This is a societal problem that needs societal investments. So we need to be working both on social norms that tell us that this is not men's work, or that this is not valuable work, or that, you know, someone who can, as I said, mow a lawn is more valuable than someone can take care of your elderly parent. But we also need kind of major investments in infrastructure and public services, because these needs are going to be increasing. And again, it's smart economics. We know that these are good, that these can be good jobs that are low carbon intensive, that help build a green economy, and that keep people healthy and increase well-being. So why wouldn't we want to invest in that, instead of, you know, much more destructive industry?
Dee asks, can you please repeat the statistic of the 16.4 billion hours?
Yeah. So this is a statistic from the International Labor Organization, and I cite them a lot because they do fantastic work on the care economy and research in particular. But we know that every single day there are 16.4 billion hours that are spent on unpaid care work. And that's why I was saying that if you tallied all of this work that isn't paid, isn't recognized, isn't seen, it would actually amount to 9% of our global GDP. So about 1/10 of all the kind of value that is produced globally in our economy, but that is entirely unseen, and not only unpaid, but actually undervalued and almost ignored.
Monique asked, is it your assessment some countries are getting the importance of investing, considering higher wages, the care sector, and change is happening, or all theory at this point?
Oh, we are seeing changes. And I would say, you know, feminists have been talking about the importance of care for probably the last 70 years at least. And that any woman has probably been thinking about the inequality of care since, you know, she figured out what care was. So this is not a new issue, but we are seeing a real change in terms of the attention it's getting from government. So, for example, just a few weeks ago, the Mexican government enshrined the right to care in the Mexican Constitution. We saw the Liberal government in Canada make these major investments in childcare. We're seeing, even in poorer countries, a recognition that these investments pay off in terms of GDP growth and kind of national levels around health and the economy. So there is a turning of the tides. That being said, we're in a moment post-COVID with inflation, fears of economic recession, and often it is public services that get cut first in times of austerity. So that's the concern. It's to say those are actually the worst things to cut, because it just furthers the problems that you're in. Then women, if you're cutting in those services, women will then drop out of the labor force. Then you have less economic production, kind of self-fulfilling. And so those investments, even in difficult times, are ones that pay off. And I don't have the numbers right on hand, but there's been very interesting cases in Canada, in Quebec in particular. That was the first province to have kind of a universal childcare system, which is kind of the $8 a day childcare system. And there was an immediate effect on women's labor force participation, which was the highest in Canada, and also an immediate impact on poverty rates for single women. So kind of the payoff of that was estimated. I know that economists estimated that the program, while costly, actually paid for itself through increases in economic participation and then through taxation.
Yeah, it's definitely a domino effect. Yusra is wondering, can you give some examples of how Oxfam works with women, especially those with care responsibilities, in light of feminist principles of programming, looking for some tangibles that organizations can do to make programming more effective and more responsible for women?
No, that's a great question. Thank you, Shra. I think one learning that seems obvious and yet took the international development sector a long time to grasp is that sometimes offering, training or economic opportunities for women is actually just increasing the burden on them. So if you're offering a training opportunity or a small business opportunity to a woman who already has no time at all, who is totally overwhelmed with the realities of keeping her family afloat, you're not doing this woman a service. So it's recognizing, are the conditions in place for these opportunities that are provided through development programs to actually be empowering, or is it just placing more of a burden on someone who's already overburdened? So I think that's one tangible thing. Another is that we really need to move from individual empowerment narratives and solutions to collective organizing. So I mentioned the work in Bangladesh, where the focus is really on building collectives, so collectives of domestic workers that can advocate for themselves collectively. Supporting one domestic worker, for example, to bring a case before the courts or to call out an abusive employer is much less effective and much less empowering than supporting domestic union workers to get together, to unionize, to have a louder voice, whether with their employers or with the government. So maybe those are two examples of how to apply feminist principles to this work. So understanding where women are at and actually responding to their priorities, and then investing in collective action.
These are all very great points. Thank you. And Veronica asked, does this approach include the foster care system? Like, for example, providing more resources to at-risk families rather than taking their children away and raising them outside of their culture in some cases and paying other people to take care of those children?
Yeah, no, that's such a good example. Such a good example that the underinvestment in communities' capacity to care for themselves and for each other has a huge impact on social cohesion, destructions of identity. We obviously have seen this in Indigenous communities in Canada in the very worst way, in First Nation and Métis Inuit communities. Yeah, that's a fantastic point.
Great. That was wonderful. Thanks so much for answering all the questions and for your presentation. As you said, like unpaid care work has been mentioned so many times in feminist literature and gender studies courses that I've taken. It just cannot be emphasized enough. And I'm glad to see that the Mexican government is moving towards that stance of putting it in the Constitution. So I think that's something that we should definitely work towards as well.
Yeah, and I mean, I give that example, but there is progress in many countries of the world, and often we think of the most economically developed or wealthy countries as being the most progressive on these issues, and it's not always the case. So I think we can get a lot of inspiration thinking of countries in Asia and Latin America. And Latin America in particular right now is very strong on care and recognizing care in legislation and public policies.
Yeah, we need to do more. Okay, so any more questions? Okay, if you have any more questions, please drop them in the chat box and Lauren will answer. Thank you for your time.
Thanks, Amy. Thanks, everyone.